Friends, welcome to my workplace at Ranaghat, West Bengal, India. This is a very hard cataract. Nuclear sclerosis is about grade 6. In this case, we have used hydroxypropyl methyl cellulose as the viscoelastic substance. We haven't used chondroitin sulfate. It is said that chondroitin sulfate is a must for such cases, but it is not true. If we use hydroxypropyl methyl cellulose, if we maintain a safe distance from the cornea, if we apply the ultrasonic energy within the substance of the nucleus, if we apply ultrasonic energy only when the tip is occluded, then we can have very good postoperative results in the immediate postoperative period. I have post-op pictures 40 hours after surgery in this case, and you will see that we have very good cornea, very clear cornea 40 hours after surgery, that is on the third post-op day. Surgery was done on 11th of March at 2 o'clock, and post-op pictures have been taken today on 13th March at 10 o'clock. So we have post-op pictures 44 hours after surgery, exactly 44 hours after surgery. Let us see how the nucleus has been managed so that the cornea remained clear postoperatively. By this time, capsulorhexis has been done, nucleus has been rotated, and now this is visco 2% HPMC applied. It has been applied earlier also. And now here goes the phaco needle bevel down. Some superficial cortical lens matter is removed. Now the handpiece is turned to make the bevel up. Now I push the nucleus down a little bit, enter into the substance of the nucleus, and with full energy, almost 85% ultrasonic energy, I go through the substance of the nucleus towards the opposite equator. All the ultrasonic energy is used within the substance of the nucleus, far away from the corneal endothelium. The nucleus is rotated on 180 degree. The nucleus is completely separated into two halves. This technique is known as submarine chop. This heminucleus is subdivided into two large fragments. Then I come to the other heminucleus. This is a minimally edited video. This nucleus management part is real time. So we have got 4 large fragments. Now I tilt each nuclear fragment, start emulsifying from its apex. Each nuclear fragment is subdivided into pieces as much as necessary, and the pieces are emulsified. Care is taken so that lot of pieces do not run around in the anterior chamber. And now this is another free fragment, another large free fragment. It is divided into 2 pieces, and then each nuclear piece is emulsified. Ultrasonic energy being used from the very beginning is 85%. Flow rate is 45 ml per minute, and vacuum is 450 millimeter of mercury. The machine is Ocular Cataract 3. This is the last but one nuclear piece. And here it is. This is the last nuclear piece. The posterior capsule has a tendency to come forward. In this case, there is a bit of trampolining of the posterior capsule. So my plan is to employ the IOL scaffold technique to protect the posterior capsule. So I'm going to leave a portion of the nucleus, a bit of nucleus, so that I don't catch the posterior capsule. The nucleus is really hard, but always the tip is in the central 3 mm safe zone, quite far from the corneal endothelium. Enough is enough. At this moment I have decided to come out. The chopper is entangled in the nuclear piece. See, the posterior capsule is coming forward. So here I leave it and come out. And now this is HPMC again. My plan is to remove the cortex first and then implant the intraocular lens and then emulsify this piece of nucleus, this much part of the nucleus. So cortex from 12 o'clock to 7 o'clock has been removed, and now I inject visco again, ethyl cellulose, and go through the side port and remove this cortex from 12 o'clock, 11 o'clock and 10 o'clock. And now I inject visco again. The nucleus goes down towards 6 o'clock. Then I implant this hydrophobic single piece monofocal intraocular lens from Johnson & Johnson. This is Sensor 1. This is a very good lens. I have no financial interest in the products mentioned in this video. The lens is in the capsular bag and the nuclear piece is in front of the intraocular lens. So I have to remove the nuclear piece. So I take the phaco needle again and enter into the anterior chamber, and this nuclear piece is emulsified easily over the intraocular lens. This is a very good technique to protect the posterior capsule. Once the intraocular lens is in the capsular bag, the posterior capsule is nicely protected by the lens, and we can emulsify any nuclear piece over the lens. We should maintain a small gap between the lens and the tip of the phaco needle, because otherwise ultrasound may damage the anterior surface of the intraocular lens. And this is a final lavage of the anterior chamber. Then integrity of all the wounds are checked, and few drops of moxie is applied over the ocular surface. Now let us see the post-op pictures. After 44 hours, cornea is clear, antechamber is quiet, pupil is round and central, and the patient has unaided visual acuity of 6 by 12. The patient is very, very happy. Thank you very much for your attention. Hope this video will help you in developing your surgical skills, and you will believe that if hydroxypropyl methyl cellulose is used in hard cataracts, it can protect the corneal endothelium.